of which is the hysterosalpingogram, popularly called HSG. And she has been found to have bilateral tuber blockage. Should we need assisted reproductive techniques, of which IVF is an important example?
Okay.
And for IVF to be done, she needs to be assessed whether or not she'll be using her eggs. If she's going to be using her eggs, she will have certain medications, which are prescription medications, that are supposed to be given in required doses on a daily basis or on a periodic basis, and should be coming in for monitoring to be sure that she's either not under-responding or over-responding, so that the dosages can be adjusted appropriately by a doctor. That is the right thing to do. And then when the time comes for egg retrieval and the culture process to be done, it is well supervised in a proper regulated environment. So that is how drugs should be used under such conditions.
Okay.
Yeah.
You spoke about IVF just now, and I know it's no longer news in Nigeria, but then access to it, of course, and then, you know, the cost of IVF. A lot of people would love to go into it, but then the access and the cost, you know, how can we be able to make this issue of reproductive health generally accessible and easy to couples?
Information is key. Education is key. Public enlightenment is key. Even though you rightly said that people are aware of it, but do they really know what it is? Do they know what it entails? Do they know the processes involved and the rest? That is the first thing to do, public enlightenment. And public enlightenment should be done by the right people and by the right associations. And a very prominent association in this environment and in this country is the AFRH, the Association of Fertility and Reproductive Health, which is championing the issues surrounding infertility and assisted reproductive technology, of which some of us are members. This is one thing to do, enlightenment. The second thing that needs to be done is to be able to, of course, that is already ongoing, is that the number of providers are increasing. 20 years ago in this country, you just had about 2 or 3 IVF providers in the country. But now, as I speak, in Abuja alone, you have almost 27 or 30 registered IVF providers in Abuja alone.
Wow. In
the whole country, it is nearing somewhere between 50 to 70. So it is becoming widely accessible and widely available in Nigeria. Even in states that didn't have IVF service providers, they are beginning to have 1 or 2 in such states. Secondly, thirdly, we're beginning to have increased access to medications, and may I say, cheaper medications. Because before now, you had medications coming from Europe, coming from the United States. Of course, they are very quality medications, but again, they will be very expensive. And so, for us to be able to provide accessible and cheaper IVF services, we may need to resort to other medications from other countries, such as India, China, and the rest of them. They provide such medications. It may not be as potent as their counterparts from Europe, United Kingdom, and US, but at least they've been giving us some results. And then, of course, the pregnancy rates are not bad compared to those that are using other more expensive drugs. And then, of course, we're also resorting to the issue of low-cost IVF, where we're beginning to have a situation where people are using cheaper medications, cheaper access to media and the likes. And then it's beginning to, even gamete sharing and the likes are becoming available in most of our IVF service provider clinics. So these are helping to cut down costs. Okay. But there are other things that can be done by government and the rest, where fertility service can be captured on our health insurance scheme. To the best of my knowledge, this is yet to be done. Things or disease conditions like malaria, typhoid, urinary tract infection, emergency obstetric care are well captured. But fertility is yet to be captured. If the government can wade into this, our HMOs, our insurance companies, will be able to assist, even our banks and financial institutions, may be able to help our indigent couples who are looking for assistance.
What is